Hi, this is Dr. Nick. I'm the incrementalist. I'm here with Healthcare Now Radio at the Connected Health Initiative in the Rayburn building in Washington, D.C. I'm delighted to be joined by Kent Dix, who is the CEO for Life365.
I am. Thanks, Nick, for having me.
So, Life365, give us a quick snapshot. What do they do? What is it? What's the organization?
It actually is a digital health platform that moves the point of care closer to the patient. We know there's a lot of challenges, and we're getting older, right? We're actually getting sicker a little bit, right?
I'm just saying, not me.
Not you? Okay. We're getting older. Some of us are, right? There's more of us that are going to be out there as well, and more demands on the healthcare system. So how can we effectively connect more people in a cost-effective way to provide better quality of care at an economic price and try to reduce healthcare costs at the same time?
And I think one of the unique aspects of Life365 is you're essentially agnostic to the solutions, the data. You're essentially bringing all this together into a single package.
We are, and actually, it would be great if it was a unique and novel approach to life, but actually the consumers are kind of driving this for us, right? I mean, we as consumers are demanding things simpler. We're demanding things on our terms. We want to get healthcare when we want it. We want to get things delivered when we want it. So it makes sense that part of the impediment to scaling healthcare as we want to consume it has to be on platforms that come to us, right, to do that.
Right.
And has to be a variety of solutions that are easily accessible as well. So we can't survive as an industry, healthcare industry, doing things disparately, with disparate solutions that everybody's got to download yet another. What was the analogy? Yet another parking app, right? That's out there, the park out there. We want to be able to have one thing that we can interface to that can solve our issues, a digital health platform, and make it easier for us to get access to care.
And I think the real key element here that I pull out, my incremental piece, is simplicity. The incremental improvement is simplifying access and simplifying engagement with patients.
Right. So let's get a lot of this out of the way. Of course, we believe in quality of care, right? Of course, we believe in privacy and security. It's the utmost that's out there. Of course, we believe in patient safety. That's a parameter of all this that's out there. But on top of all that, you've got to have simplicity, right, as well. And simplicity, I always say to my folks, is that the more simple you can make for people to engage in their healthcare, the more complex it is in the back end.
Absolutely.
Right? So if it's complex for the user, that means that we were a little bit lazy in what we're doing, right? We're making the user make the decisions and do stuff when the system should help guide them through the journey and simply be there to make it simple for them to engage, right? So it is simplicity, but there's a lot of complexity that goes through simplicity.
So hiding the complexity. So
Absolutely.
To borrow from somebody very famous that said this, Life365 makes patient engagement as simple as possible, but no simpler.
Yeah, there you go. Thank you. We should hire you.
Thank you very much for joining me, Ken.
Thank you, Dr. Nick.
I'm Dr. Nick. I'm the incrementalist. I'm with Healthcare Now Radio, and I'm here at the Connected Health Initiative in the Rayburn building in Washington, D.C.